Hi, everyone. Thanks for joining us today. My name is Simone Sutton from Cigna, and my role is dedicated to the state of Colorado as a health engagement consultant. Today, I'll be reviewing the benefits and resources available to Cigna members. I hope there's something I share today that you'll learn for the first time. Enrollment is a really important decision, even in a passive year. For example, if you're planning a major surgery or expecting to expand your family, you may want to reassess which plan is right for you. These are some key steps to keep in mind during enrollment. If you're new to Cigna, welcome. Check Cigna.com to see if your doctor participates in our network. Call our concierge service One Guide at the number listed on the screen, 888-806-5042. to discuss your plan options with a personal Cigna guide. This number is available to you 24/7, including weekends and holidays. Really think about your health history and how you will be using the plan. Review your summary of benefits for specific plan details and visit the State of Colorado Employee Benefits DHR website. That's where you can find more details about the plans and premiums. Is your doctor in Cigna's network? If you'll be switching to Cigna, you can find out if your current providers are in Cigna's network. When you get to Cigna.com, click on Find a Doctor, Dentist, or Facility, select that you are covered by an employer, make sure to enter your location, and then select Open Access Plus for the type of plan. If you're already a Cigna member, you can log into mycigna.com to find doctors in care. Your plan options. These 3 plan options are the same as last year, so no changes here. Each option has individual or family coverage. Preventive care such as well woman visits, annual wellness exams, and preventive screenings are always covered at 100% under all of the plans. I'm going to use the high deductible health plan as an example. You or your health savings account funds will have to pay out of pocket until you reach your deductible. After you reach your deductible, the plan pays 75%, and you would be responsible for 25% until you reach your out-of-pocket maximum. Everything is covered at 100% after you hit your out-of-pocket maximum for that plan year. I would like to point out, after each eligible family member meets his or her individual out-of-pocket maximum, the plan will pay 100% of their covered expenses. Or, after the family out-of-pocket maximum has been met, the plan will pay 100% of each eligible family member's covered expenses. I also want to note here, for the copay plans, the copays don't count towards your deductible, but they do count towards your out-of-pocket maximum. Cigna One Guide. One Guide is a very useful concierge level of support that combines telephonic or online chatting and can help you make smart choices about your healthcare. Whenever you need us, just call the number printed on the back of your Cigna ID card for 24/7 every single day of the year assistance. We also have translators available that can assist you in one of 200 languages. Get the most out of your plan, understand your bills, and be an informed healthcare consumer. mycigna.com. On MyCigna, you can find in-network doctors, view or print your ID card, manage claims, compare costs, use wellness tools, and track deductibles. You can also access MyCigna by downloading the MyCigna app. We have a click-to-chat function on the site so you can ask questions in the moment. They can even answer claims questions, which I use all the time instead of calling in. Costs can vary differently for services like an MRI, so depending on where you get it done, it's really important to know ahead of time and plan to compare your costs online when possible. You can also utilize Healthcare Blue Book to compare costs for procedures and possibly even earn rewards. When you're logged into MyCigna, it knows what plan you have and can estimate your costs accurately. Click Show Math for a breakdown. This allows you to get the most cost-effective and best care possible. Cigna Care designation. This symbol with the C, this indicates doctors and providers who have proven history of achieving good quality outcomes while also being cost effective. Providers will have that symbol next to their name when you search on My Cigna, and they will populate at the top of your search. Our health information line. This is available every day of the year telephonically and Monday through Friday via chat. Offers a trained clinician to help you determine when and where to get treatment for immediate healthcare needs. And it provides guidance and education about specific health topics. Know before you go. So we have quite a few employees that frequent the ER in cases that might have been steerable to urgent care or prevented with more regular care from a primary care physician or a PCP. From left to right, the lower cost time for care would be virtual care, which we'll go more in depth on shortly. Then clinics, doctor's offices, urgent care, and then last resort or for very certain symptoms, the emergency room. The emergency room is the most expensive option, and wait times can potentially be long. But if that's the right care for you, if you're experiencing certain symptoms as listed on the screen, then that's the way you should go. Take control of your health and your health costs. Similar to what we just covered, save money on expenses by staying in network, visiting urgent care instead of ER, using clinics in supermarkets and pharmacies, and accessing virtual care. Saving money is top of mind for most right now. Some additional ways that you can save money: using national labs like Quest and LabCorp, choosing independent radiology centers for MRIs and CT scans, and having procedures like colonoscopy and endoscopy at in-network freestanding outpatient surgery centers. Virtual care. Yeah, it's really that convenient. So life gets very busy. That's why using virtual care may be a great option for you to get preventive care or address minor medical issues without leaving the comfort of your home. Virtual care is available 24/7, 365 days of the year. They even have pediatric care, which I personally use quite often for my toddler, and they could prescribe medication to your local pharmacy. So you can connect to this service through the MyCigna app or website, or you could also download the MD Live app as well. That's what I personally use. It's a lot easier if you register for this service ahead of time. That way it's just ready to go when you need it. All you have to do is sign in, and all of your information is already accessible, and you just have to schedule the appointment. I usually see a doctor within about 5 to 10 minutes when I need to utilize MD Live. And keep in mind, they can send information to your primary care physician with your permission. So that's one of the boxes that you can check when you're scheduling the appointment. So sometimes individuals don't remember what they can use virtual care for. So we cover primary care, behavioral care, urgent care, and even dermatology. Here are some of the conditions that can be treated through virtual medical care. As a reminder, Marathon Health, formerly Everside Health, is a phenomenal option and an employee favorite for medical and behavioral care. It's also the most cost-effective, as you could see on this screen. MD Live through Cigna has flat fees and copays associated if it's outside of preventive care. Just a reminder, all preventive care is covered at 100% on all of the health plans, and these include services as listed on the screen, such as screenings for blood pressure, cholesterol, and diabetes, screenings for cancer, mammograms and pap tests, PSA blood tests. Those are just some examples. The copay plans will have zero cost share for all mental behavioral health services, including outpatient, inpatient, and virtual. So no cost actually means no cost here. And for high deductible health plan members, they get 3 no-cost visits per issue to select providers. And this can be organized by calling Cigna or visiting mycigna.com. Happify and iPrevail are also available at no cost to all Cigna members regardless of your plan option. Maternity support programs. When you're expecting a baby, you have big decisions to make and probably a lot of questions to ask. Enrolling in Cigna Healthy Pregnancies, Healthy Babies gives you additional support at no extra cost to you during your pregnancy and after. There's an incentive for participating in this program. So you could get $150 if you enroll during your first trimester, $75 if you enroll in your second trimester, and Kaiser members can also complete their maternity support program to qualify for the incentive. They would just have to complete a form with their doctor and email us at coloradowellness@cignahealthcare.com in order to receive the gift card incentive. Cigna Healthy Rewards. So this gives you extra discounts on certain products and services, and you can find more information on this on mycigna.com. One of the big ones I want to call out and most popular is Active and Fit program. So this would be our version of a fitness center discount membership program. So with over 10,000 fitness centers nationwide, Cigna customers can enjoy membership for as little as $28 a month. There is an enrollment fee of $28 as well, and this is for the Active and Fit program. We also have a program called Daily Burn that you could get discounted membership to, and they have on-demand videos such as kickboxing, bar, strength training, Pilates, and there's also discounts on Fitbits, yoga products, so you could definitely check that out on mycigna.com. The Travel Reimbursement Program. The travel reimbursement benefit will cover all on-site, in-network behavioral health services if you don't have a provider within 60 miles of your home address. For medical services, the travel reimbursement benefit applies if you don't have a Cigna Care designated provider within 60 miles from your home address. The steps of how to get reimbursed are on this slide for later reference and can also be found on the state's benefits website. You will see some of the eligible expenses versus the non-eligible expenses as it relates to this travel benefit. These have not changed. And in closing, the dedicated team that I work with at Cigna, our focus is solely on state of Colorado. Our mission is to improve the health, well-being, and peace of mind of those we serve. Thanks for your time and attention today. And listed on the screen here are the numbers and important email addresses to reach us if you have any questions. Thank you so much and take care of yourselves.